All right, so major new COVID restrictions take effect in San Francisco today. Anyone who wants to eat, drink, or exercise indoors in that city must now show they are fully vaccinated. The mayor says the mandate is needed to slow the spread. Business owners say they plan to have extra staff at the front door to verify people's proof of vaccination and to make sure they match their identity cards. Joining us now is Dr. Zafia Anklesaria. She's a pulmonologist with Dignity Health California Hospital in downtown Los Angeles. Doctor, thank you for being with us. I believe we have some audio problems here, Doc. Can you hear us?
Yes, I can.
All right, perfect. We got you now. All right, let's start with those new mandates. You just heard me talk about what's going on up in San Francisco. LA County is requiring people to mask up at big events. Why is this so important, in your opinion, to put these into effect right now?
Well, let me just start by saying that masks do work. It is my mask that's kept me safe for over a year while I've stared directly into the mouth of multiple COVID patients every single day. It's not just my immune system. It's not just because I'm young and healthy. Masks really do work. The reason it's so important, especially right now, is because we have a highly transmissible variant that's spreading like wildfire. And when you're in a very large gathering, outdoors or indoors, you don't know who you're around. You don't know whether you're around a person who's sick or they're pre-symptomatic, vaccinated or unvaccinated. So the Delta variant, unfortunately, can spread much more easily than the original COVID. And it's very important to wear your mask when you're around people that you don't know. So I'm in full support of this mandate to mask in large gatherings.
All right, you work there in the ICU. What are you seeing right now in terms of patients and numbers?
Well, I can't give any specific numbers, unfortunately, but we are seeing a very large increase in COVID patients since June of this year. We had gone down to almost none after the winter surge. And now we're seeing a very large number of patients, primarily young patients, unfortunately, between the ages of 30 and 50, who are very, very sick and dying in our ICU. And it's just tragic.
Let's talk about the doctors and nurses here for a second. How are they feeling after dealing with surge after surge for the last, year and a half now?
You know, I'd be lying if I said we're not tired and we're not frustrated. We show up every day and we do our job and we do it well. We feel the same way we feel when somebody comes into the hospital without taking their medications or putting dangerous drugs into their body. We feel the need to explain to them what they could and cannot do differently. But yes, we are certainly tired. We are going to continue to do our jobs, and we're more than happy to care for anyone who comes through our doors. We are asking at this point, actually imploring people to do their part as well. There is a highly effective vaccine out there with great safety data. And the drugs that people come into the hospital and need, those are the ones that are more experimental and dangerous. And when people need them to keep alive and stay off the ventilator, they don't hesitate to take those. So I encourage you, instead of needing those eventually, to take a safe vaccine and wear a mask. It's not very hard. I do it every day.
Before we let you go, I need to put you on the spot because I learned that you were 7 months pregnant and you started to treat COVID patients. How was that personally for you? And by the way, how's the baby boy?
My baby's great and he's healthy. Thank you for asking. He turned 1 just a few days ago. And yes, I worked right up until my 8th month of pregnancy, and I came back from my maternity leave right in time for the winter surge. And I managed to keep myself and my baby safe. Thank you to everything. Yes, so it was definitely very stressful for me and my family, but I relied on my protective equipment and on my hand hygiene and on my trust in science. And I feel like that's what got us all through this.
Dr. Anklesaria, thank you for your time here this afternoon. We appreciate it. And I love the fact that you keep smiling when you can through all of this. Thank you so much.
I do have one thing to say to people. Sure. Is now is just, it's not the time for arguments. It's not the time to make anything about politics. It's really the time to cover your mouth and nose, roll up your sleeve, and just take a jab for humanity. We really need it.
All right. Thank you once again. Have a great weekend.
Okay, you too.